Welcome to our virtual hangout this evening, summer book series carrying on. We're glad you're with us. And hopefully, those that are joining are some of you that received this book in the mail and really had a great time reading through it. And if you're like me with a pen and a highlighter and kind of writing and making notes along the way, it'll be really great to have one of the co-authors with us this evening. So any questions that you have, make sure you have them available. We'll get them all answered for you.
Yeah, I love it, Erin. And do you believe that we're at the end of August? That's what's crazy
No.
to me. That, this summer book series, we've been looking forward to this for a long time, hence getting all of the books out in the mail and the people who received them that were our early registrations. But it felt like it was so far away. And here we are.
Yeah, time flies when you're having fun.
Yeah. Well, Erin, I feel like a little bit of housekeeping, right? Should we do a little housekeeping? I think a lot of our folks know about Zoom and are very familiar, but we love, utilizing that chat. They're already putting where they're coming through. Please keep yourself on mute just so that we have everything, tidied up for our speakers, that they're not hearing background noise. And I don't think there's anything more that our friends need to know, right? That's
Yeah, we'll
watching
start
the
to
chat.
watch in the chat. We will have a little bit of a presentation, which will be great to sort of lay the groundwork for the context of our book that we're featuring this evening. But there'll be plenty of time at the end for discussion and questions. And like I said, we're so grateful to have one of the authors with us tonight. So I'm sure we'll have really robust discussion, but know that if for some reason you have to hop off early, or if you want to share this with someone that may be interested in hearing our discussion, we are recording and it will be in her library. So you can always come back and re-listen. There'll be resources that we're sharing and lots of links that we're putting in the chat because the Healing Works Foundation in and of itself is just filled with great information that we'll share with you also.
Perfect. And then, of course, none of this is possible without our sponsors. So we are
Absolutely.
very grateful for them. We do over 40 of these a year. Erin is very busy getting all of our speakers, and it has been an incredible journey for us because we started this during COVID and saw the need of this virtual space. It's a community, right? But it's truly a Unite for Her network. It's like a channel that we have all of these different offerings, whether it's an Ask the Experts or speaker series or virtual hangout or cooking webinars. And we couldn't do any of that without those that support us. So a huge shout out to our presenting sponsors, which is West and Merck and Daiichi Sankyo. And then we get additional support from Lilly, GSK, Gilead Sciences, Pfizer, and then Immunogen, which is now a part of AbbVie, and all incredible partners that are with us all year long. And that is key, that they're always there with us all year long. So we appreciate them and appreciate them there to support these incredible sessions that we give each and every month.
Absolutely. And with that, I want to share my screen because we do have an exciting September coming up. So although we're the end of August, we are moving full steam ahead with some more education events next month for Ovarian Cancer Awareness Month. So our dietitian team is joining you again for our first virtual hangout in September. We're doing that favorite seasonal cooking methods 101. So we'll be highlighting a fall ingredient, a fall food to be determined, where we still have that vote out on social media, but all four of our dietitians will be highlighting an ingredient and sharing with our members different methods on preparation just to give you some more confidence in the kitchen. And then we have her speaker series, which is happening on the 12th of September. And we will be welcoming back Lorenzo Cohen and Allison Jeffries to talk about and highlight one of their mix of six, which is all about stress and fostering calm and resilience in everyday life. So one of the topics that we are asked about and was an idea given to us several times was really highlighting that relationship between stress and cancer, which we know was also discussed in Healing and Cancer, which we'll go over this evening. But it's really nice to have an additional topic. We're jumping into redefining intimacy with one of our providers, Nicole Drebelis. So we're happy to have her. And then we've got two fantastic events happening on the 26th. Specifically for our ovarian cancer community. So hopefully you'll be able to join us. All of this information you can find at uniteforher.org, ways that you can sign up and ways that you can join us. So be on the lookout on our social media, in our newsletter, and on our website.
Yeah, fantastic, Erin. Erin, I didn't see you do the pointing. What happened to our
I
black screen?
know. I know. I
Oh,
need to
you're
work
so
on
good
my
at
weather
that. Oh,
girl
I thought it was really
skills.
good. Erin has found herself on a black screen. With that, she can point behind her and she looks so professional, just like those influencers on TikTok.
It's
I
gonna
always,
rain over here and all.
right. All right, Erin, should we get into our summer sips? I'm
I
loving our
love
guest
this.
because he's been with us forever, right?
I
Yeah.
know. So we are so excited. Do you want to introduce Adam? I know that he has been connected to Unite for Her for so long. We're so thrilled to have him.
He has. I would be honored. Adam, thank you for joining us. So, Adam Junkins, he has more than 2 decades and incredible dedication and experience at Savannah Bistro, which is a cornerstone here in the Chester County area. Since 2004, his passion for fine wine and exceptional service has been a driving force behind the restaurant's acclaimed reputation. But Adam seamlessly transitions from curating wine lists to overseeing all aspects of the restaurant. I have seen him in action. My son actually has worked with him and had the honor of learning under him. And he has great leadership and sommelier skills, and he just elevates Savannah Bistro to new heights. His commitment to the art of fine dining and his genuine care of the guests and the staff alike make him an invaluable asset to Savannah Bistro and the Chester County hospitality community. And I just love that I get to have you as a guest today, Adam. Adam is also one of our sommeliers for our big chef and wine tasting event. And honestly, Adam and Nick were the first ones I went to when we first did Harvest. I don't know if you remember that, but Harvest is now 12 years old. And we have been doing this incredible event, but they were my go-to, and we created this incredible chef and wine and mocktail experience event. So, Adam, loving your background, loving where you are, it makes me happy, and thank you for joining us.
My pleasure. Thank you for having me.
You got it.
So despite all this alcohol behind me here in my picture, we're going to be doing a non-alcoholic mocktail this evening. We were discussing before this started how the non-alcoholic trend has really blossomed, and there's so many more options. Whether it's just you want to take a night or two off from drinking, or you can't drink because you're sick, or you're pregnant, or you've just chosen not to. There's so many more options, and our restaurant features some really great non-alcoholic cocktails. But I think for me the big key to making these things is to make them interesting, and to make them unique, so that it doesn't just feel like you're drinking lemon juice. But also you want to make them simple so that they're not, so time consuming that you just don't feel like you want to make them. So tonight we're going to be doing a cucumber rosemary smash. This kind of hits us right in between that summer and fall vibe. So we have cucumber and lemon, which is really refreshing. But we've got some rosemary in there, kind of signifying, some of the flavors you get in fall. I know Erin has posted the recipe for this, but I tried to make something that everybody can make at home. One of the main ingredients here is a rosemary syrup. There we go here. And it's really simple to make. When you make a simple syrup, you're just doing equal parts sugar and water. I like to use natural sugar or raw sugar. And you're just going to heat this to just below a boil. You want to keep stirring it so it doesn't burn the sugar. Whenever I'm adding like herbs or natural botanicals to a syrup, I don't just throw it in there while it's boiling, because sometimes it'll give it a cooked taste, and you don't always want that. You want it to be a little bit fresh. So what I do is I bring it right up to a boil, make sure all the sugar is dissolved, take it off the heat, and throw some rosemary or whatever, basil, whatever you feel like doing in there. And then you let it sit until it comes down to room temperature. And then I throw it in the refrigerator overnight and let it steep for even longer. And then the next day, you're going to strain out the rosemary or the basil or whatever. And it really adds some fresh flavor to the syrup without giving you that like cooked, sometimes if you cook basil or rosemary, it tastes a little bit different. But that's not what we're looking for here. So That's the main ingredient that's sort of going to bring something interesting to this. So what I do is I take my shaker and I've diced up some cucumber. There we go. Some nice fresh cucumber. You can add as much or as little of that as you'd like. You know, I take a muddler, just not showing up here. There we go. And you're just going to crush it up. You can leave the skin on if you want. I've peeled these part way. Sometimes the skin can give you a little bit of bitterness from the chlorophyll, but you're just going to kind of mush them up, and you're really going to get some nice juice out of that cucumber. You want to taste that fresh juice from the cucumber. And then the two main ingredients in this outside of the cucumber, you're going to go equal parts. So we have our rosemary syrup. We're going to measure out 1.5 ounces of that. And we're just going to put it right on top of the cucumber. And we also have just fresh squeezed lemon juice. You can get lemon juice from the store. You can squeeze it yourself, however you prefer to do it. So we're going to do the same thing here. We're going to do 1.5 ounces. So now we've got this sort of like balance of sweet and tart. You've got the sweetness from the syrup and tartness from the fresh lemon juice. And then we've got this freshness from the cucumber. Then what I'm going to do is just going to throw some ice into this shaker. And I'm going to put my top on it. And then I'm going to give it a really good shake. This is that smash part. This is where you're really integrating the syrup and the juice and the cucumber flavors. So then I already have a glass here with some filled with ice. And what I'm going to do is once I'm done shaking it, I'm going to just strain it right into that glass. If I can. And if you have a little bit of a different, like a thicker strainer, might be a little bit easier with the cucumber muddled up in there, but otherwise just have a little patience, and it is filling up slowly but surely. And then what you're going to do to finish this off is we're going to top it off with tonic in my recipe. I like Fever Tree tonic. You can get a lot of small batch tonics that are not your your Schweppes or things like that are mass produced. You can even look up recipes. I've made my own tonic before. It's pretty delicious. If you don't like tonic, you could also just use soda water. You could use ginger beer, which also is a nice touch on this. So this is a really versatile drink. If you've kind of got preferences on what you do or don't like, this kind of gives you some options there. So then you're just going to take the rest of this. You're going to finish it off with the tonic. Okay, and it just gives that nice fizz to it. I'm going to garnish this with a lemon wheel. And then this is the last touch, and this is what really kind of adds that fall vibe to it. I like to torch or toast rosemary. You just kind of take a lighter to it and just give it a little singe. And it's almost like incense. It's really gives some aromatics. You're just going to get the ends to be a little smoky there. And then you're going to toss that in the drink. Obviously, you don't want to poke yourself in the eye with that while it's still lit. But once it goes out, it kind of gives this beautiful aromatics to the room. And you can smell it while you sip. It kind of hits all the senses. So then there you have it. We have our cucumber rosemary smash. Super refreshing. Great for the end of summer. Great for the beginning of fall. And it's non-alcoholic, so you can drink it anytime. Bring it to work with you. Cheers.
Cheers. I am loving that. So you said that you made your own tonic. You're intriguing me now. How do you make your own tonic? Because I am all about a homemade tonic or a elevated tonic.
It's been years, but what I did is it's made from a specific type of tree bark, and I'm not going to try and pronounce it here because I know I'm going to get it wrong. But if you Google it, there's some recipes online. But it's this tree bark is what adds the quinine initially. Now they do it sort of in a chemical process. But quinine is what gives tonic its taste. It's tart and it's kind of bite to it and its bitterness. So this tree bark tip traditionally was from India. And so I would take that, and I took some citrus peels, other aromatics. You can add and subtract things too. So as you're liking, and when you're done with it, it's got this really sort of it's got a lot of pop and a lot of bite to it. And you can now you have like soda streams and you can actually make your own bottle of tonic. But what I did was I made like a syrup out of it and then added it to a drink that I would then top with soda water to give it the fizz.
Oh, I love it. Yeah, you actually just made me look that up. So I saw the tree. I understand. So
Did I pronounce it?
Cinchona, is that right?
I think
Cincona?
so. Yeah.
Yeah, it's very cool. I do remember like when I was diagnosed, it was like 20 years ago. I remember drinking this ACEAC tea, and it was a tree bark. It was tree bark that was in this ACEAC tea that I used to drink. I would get it at a Whole Foods. It was a combination of all different kinds of things, and it was not delicious at all. It was not delicious at all, but it was a tree bark. I remember hearing, and I'm curious if it was very similar. Yeah.
Yeah. I mean, I know that this specifically has the quinine, which sounds like a
Correct.
but
Yeah.
that's what is in tonic that gives it its sort of flavor. Yeah, I think initially tonic, it has medicinal properties, especially
Correct.
when you
Yeah.
make it, naturally. Like I said, the mass produced ones and probably even the fever tree probably don't have too much, natural healing properties. But if you did make your own, I'll bet you could probably get a little bit more out of it.
Amazing. Well, thank you, Adam. Loved having you as our guest. Nice
My
way to
pleasure.
open a virtual hangout. Yeah,
Absolutely. It's my pleasure. Thank you so much for having me.
you got it. We'll see you at Harvest soon.
All right. Thank you.
Wonderful.
All right, Erin, I'm going to pop you front and center.
Yeah, thank you. And I do want to say quickly before I introduce our guest tonight that I will be putting into the chat all of the recipes from our summer sips. So hopefully you've been following along all summer for all of our zero proof recipes that we've been putting on our blog and sharing on our social. We've got plenty more recipes, so I'll be putting all of the links in the chat for that. And then, as Sue said, we'll be featuring more at our Harvest fundraiser this fall. And of course, we're in planning stages for Plantuary in January. And we will be featuring more zero proof recipes if those that are partaking in dry January. So we've got plenty more to come, lots more inspiration for some zero proof mixology. So with that, I am very excited to introduce our guest this evening. So Dr. Alyssa McManamon is a practicing hematologist-oncologist and a retired U.S. Air Force colonel. She is an associate professor of medicine at the Boonshoft School of Medicine, Wright State University, and clinical faculty at the Dayton VA Medical Center. She graduated from the University of Virginia with a degree in sociology before attending medical school at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. She trained in cancer medicine at the National Capital Consortium, completing a research year at the National Cancer Institute. In 2021, she was one of 100 practitioners selected to complete the NCI-funded University of Michigan Integrative Oncology Scholars Program, and she founded a first of its kind VA Whole Health Oncology Clinic. So please join me in welcoming our guest and co-author of Healing and Cancer, Dr. Alyssa McManamon. Thank you so much for being here with us this evening.
Thank you, Erin, and thank you, Sue. And it's wonderful to see people with their cameras on and to see faces here and taking time out of your day to have a book discussion. I am going to share just a brief slide set just to kind of get us all on the same page. You may have the book in hand, but you may haven't seen the book or read the book. So just to start with that, and then certainly happy to have discussion and questions. So let me get that going. Okay, you guys can see that? Wonderful. So yes, this is going to be about whole person cancer care, which certainly is part of the subtitle of our book, Healing and Cancer. And the hope for our discussion today, and really for the book in general, is really to empower people to take an active role in their care. And if you're here, you probably already have done that, but I just wanted to say, that's really our goal for everybody. And so I think the introduction already spoke to this. I do want to say that when I was at the NCI for that research year, I actually was part of the women's malignancy branch, in particular with the ovarian cancer team. So I really got a sense of what it takes to enroll on a clinical trial and to come back and forth to Bethesda for patients and families and caregivers. And it just really was an impactful experience for me as a learner. And since then, I've had gynecology, oncology colleagues who take care of patients with ovarian cancer. So I haven't done as much of that, but I certainly have an appreciation for the field. My disclaimers, of course, because I do work also for the government, are as listed. And who is and what is Healing Works Foundation? Well, it's a very effective and small team that's led by the president, as you can see him in the middle there, Dr. Wayne Jonas, who is the co-author of Healing in Cancer, which we wrote together. What the purpose is really Healing Works Foundation has been working for years to make whole person care, what we say, routine and regular. And initially that was in primary care. And then in 2020, when I joined, it was also to move toward oncology care. How do we make whole person care happen in cancer care and in those care teams that provide the care? And so we got together and worked with about 13 either institutions or cancer centers who provided people who were interested in integrative oncology and who wanted to be leaders or learn more from other leaders in that field. And for almost 2 years, we met monthly with what we called the Integrative Oncology Leadership Collaborative. And so out of that work, we developed a lot of tools and what we would call a toolkit to provide whole person care. And I'm going to show you a little bit of that later. But also some of the resources that are created. Everything is open access and freely available to both you and your care team members. And it's all been vetted by subject matter experts who are part of that leadership collaborative. So out of that, we said, why don't we write a book and really bring these ideas to a larger field of oncology? And so one of the tools that I use regularly in my clinic is called the Personal Health Inventory. It's literally a 2-page intake form that I actually started using when it was just the one for primary care before I ever did any work with Healing Works Foundation. And it has this graphic, which I think most people can really hang on to very easily. They can kind of understand what this means. So all of us have multiple layers of who we are. And if somebody comes with a new diagnosis of cancer, certainly that's affecting the body and the external potentially, but there are also other things that we're going to talk about. And the person is understanding when I show this graphic that we're talking about who you are in the whole, that you have, yes, a body, but you also have behavior and lifestyle that, is important to you. You have social and emotional life. And also you have aspects of spiritual and mental, parts of you. And so when people see this, they understand that we're going to have a different conversation as we begin to talk about, yes, treat the cancer, but also you're a whole person here sitting in front of me, and I'm trying to understand how to take the best care of you. So I know you've had other speakers, and the Mix of Six is a wonderful framework for wellness. And this is a different one. This is from Cancer Choices, but you can see a lot of overlap in what really are the components of wellness. The one I'm focusing on here in the middle is exploring what matters now. And that's literally the question that I'm trying to get at when I do an intake in, say, the whole health oncology clinic with somebody. What matters now? And what matters now can change over time. But what matters, or your why behind what it is you're looking for, really can help motivate toward all those other things that are the components of wellness. It's harder to motivate against something, like it's harder to motivate against, heart disease than it is to motivate towards something. And so trying to figure out what your toward is and getting you to that is what's important here. So first, finding out what matters to the person or the patient, and then really being able to coordinate services and support for them. And so that's the difference. So I was practicing oncology for many years, and I consider myself a very empathetic person. I feel like I was doing the best that I could, but I don't think I was always seeing the whole and providing holistic care. And I think that's been the journey for me, and I really, hope to share that. Like I said, in the beginning, I was using the primary care form, and this was Rebecca, one of the very earliest patients. And I was working with a social worker. I asked the social worker, can you use this intake form and then come and present it to me in front of the patient so we can see if we got it right? What she, are we interpreting what she's saying correctly? And the form asks, what do we need to know about you to give you the best care possible and things like that. So here, Rebecca was a premenopausal woman in her 30s, and I already knew that from looking at her chart. She had ER-positive breast cancer. And what I didn't know until the social worker and Rebecca came into the room was that what really mattered to her most was her career. She was married. She'd been married for 10 years. She and her husband were not trying to have children. She was really had a schedule that she was trying to follow to get her college professor, career on a trajectory that continued. And this breast cancer thing was a big wrench. And so learning what mattered to her, we really quickly learned her perspective. She had no interest in preserving an ability to bear children or breastfeeding. She wanted a mastectomy and reconstruction and no radiation, and she'd already done her homework. So having a conversation like that at the beginning, the very beginning when I met her, was so instructive to me, because I otherwise would have been going down all the roads that my national guidelines say I have to do to treat every premenopausal woman with breast cancer, which includes fertility preservation and all the things. So, it was just a real learning experience for me, and we were able to meet her requirement and her wishes, which was really a lot about timeline and not to change anything about her. So as I got further into providing this care, I started to see that healing patients or being involved or participatory in their healing endeavors was actually healing to me as a provider. And so I think that's the message for providers out of this book that I hope comes through, which is that we all can heal. And I think in community and really in being whole people together is where that's at. This, just a couple more slides. This one's important because I want to show that whole person cancer care is really the nexus of all these different kind of fields together. So the cultural context of health, that's happening for all of us. That's really, unfortunately, mostly related to our zip code, right? And we know that these other things may not happen robustly depending on what zip code we live in terms of conventional medicine access and that sort of thing for cancer care. But we do also want to show that the nexus of everything together is what we consider whole person cancer care. So when a patient comes to the clinic and says, what can I do to support myself, my health and my well-being as I go through this treatment that you're planning out for me that I may or may not want to do? How can I support myself? That's that self-care part. And we know that the research is starting to really support, what are those things that people can do that can make a difference during and after cancer treatment for their health. And then the non-drug and complementary approaches, of course, you guys in this group, Unite for Her, is so aligned with all of that. And I think, I just want to show that it's not that we leave something out. We're not leaving anything out. We're saying it's all good and you're all good. We're just going to listen to what you're motivated by and try and support you to get there. So briefly on this slide, I won't touch on everything except for to say, so if a patient, say with breast cancer comes and, is concerned, what matters to her is she wants to continue to work during treatment, which is going to include chemotherapy. Top right here is what we're showing the breast cancer patient. And she doesn't want to be so tired that she can't hang out with, her family and participate. And so really, if we can get somebody to know the data about emerging, what does exercise do to decrease fatigue in the post-month after chemo is completed, to decrease fatigue by that kind of percentage, just from doing this amount of walking in the course of chemotherapy while you're on treatment, that's an amazing finding. 43%, I think it is. It's hidden on my screen. But we need to be able to talk to our patients about the research that's out there that's well done and that can help them when they have those questions about what they're trying to get. All of us on the top left are trying to figure out, of course, how to prevent health issues, right? We're always still trying to stay away from something, but it's maybe simple, but it's not easy. So it's easy to pick up fast food. I struggle with that, right? But it's not simple to have all the vegetables cut up and ready to go for the week. So I think that there's no shame and no blame here. Although we talk about prevention and we're all focused on that, certainly, I think that we all have to be, on the same page that this is not easy, and we are helping patients if we can actually get people to health coaching or to those other team members. Social support, we know how important that is. And I think the thing that I've learned is that people do come alone. They come to the clinic alone and they have nobody on their emergency contact list and they have a new diagnosis of cancer. And the epidemic of loneliness that the Surgeon General talks about is completely real. And I think that's starting to be a new area that I'm thinking about. How do I triage patients who do come to the clinic alone? Do they need more support? I think yes. And when Wayne and I, just as an aside, we gave the book to a colleague who works overseas, we'd signed it. He happened to open it to the chapter that says, when they come alone. And he was like, this is the issue. This is my problem. And I was like, so oncologists want to help. They understand the issues. It's just, how do we get on the same page to make some differences to help people? And it really comes back to team care. And so making what matters to the person as important on the team, like as much of a guiding force in terms of advice as all of us on the team who are medical practitioners or otherwise, or even caregivers ourselves and family members, I think is so important. And I couldn't have started this process without like tapping into a social worker, for example, to try and do this in my workflow. So I really want to just state that. Last couple slides, just this is for patients, How We Heal campaign. This gets you to the resources that are patient facing that were created by the Learning or the Leadership Collaborative. Healing Works has created this website for patients. Please share it with friends and look at it. And then what's on that website and what's also on the Healing Works Foundation website are pocket guides with all these topics that are on the right. They're important when people are going through cancer treatment and after. And so if you have a provider who's maybe not up to speed on cannabis in cancer care, but you have a question about that, you can educate yourself in whatever way feels comfortable. But if you want to educate them with something that's been vetted by a subject matter expert, you can pull any of these things or get them to these things on the website. And it's freely available and reliable, safe information. So that's the website they could go to, or you also could. And then, yes, Wayne and I wrote this book, but we were like, some people don't read books and we don't have an audiobook yet. So it's like, what else can we do for doctors and nurses? And we do have a continuing medical education course that your care team members could be directed to. It's completely free. It was created in conjunction with Tufts University. It's 3 hours of free, what we say CME or continuing medical education. And it's about whole person care. And it's really based on, again, the book, the learnings we had over those 2 years, and giving exemplars of places that are doing whole person cancer care. So I just thank you for your attention, and I will stop sharing slides so we can move forward.
Wonderful. Thank you so much. And going through the book and I love how you broke out all three, how you had 3 different parts, sort of kind of that introductory part, and then working through the whole entire treatment, and then resources and guides, and really always going back to that focus on whole person cancer care, which I think is, we're really just starting to make this a common vernacular in when a person is diagnosed with cancer, is really addressing the whole person. So it's lovely to see that this is just like the center core of this entire book, and gives patients a lot of tools that they can use as they're entering into these conversations. So I'm curious if anyone here that's read the book or just wants to share their own experience as we hear this theme through the book of whole person cancer care, and really having the patient share what's important to them, leaning on those core wellness factors that she touched on, but how your experience may have been similar to what Dr. McManamon is advocating for, or how your experience may have differed. So I'm curious, how this resonated with any of our readers here tonight.
Yeah, Erin, while we have people jumping into the chat, we had a couple questions, which I thought was really great. And Katie was just asking if you ever thought about turning the content into a podcast, just knowing that people might not be reading as much. And
thank
so
you. I forgot to mention.
Really good one.
That's so great. I didn't see that yet in the chat because I hadn't looked, but yes, there's a podcast, and that is available. It's called How Healing Works Season 2. So that is available. Wayne and I either speak to each other about these concepts, and or we individually interview subject matter experts, kind of along the lines of what you just suggested. We just dropped an episode this week with Channing Paller, who is, a prostate cancer specialist. So maybe not for this crowd, but an integrative oncology sort of provider. So we have different subject matter experts, and that's available freely.
I love that. That's really exciting. Yeah, Jenny, thank you for posting that. I think listening in the car or listening as we're out on a walk, having that audio is even just a good reminder for all of us. Just kind of having that constant continuum of information.
Yeah, I know we have a couple folks too just interested in getting your book. So I know that we had limited copies that we were able to get out for our first couple that were registered, but obviously we can get right there on Amazon, right? And I can put the link in there, or if you wanted us to direct them right to your website to get the book, but that's another way you can get that book. And thank you, Jenny, for putting that in there.
Yeah, wonderful. So if anyone wants to come off of mute or raise your hand, I know we had one comment in the chat. Julie was grateful to have a wonderful breast surgeon. She made her choice right away and supported that, and took time to walk through all of the options. I think that's really wonderful. I know I hear so often it feels like you're moving 100 miles an hour at the beginning. So having the conversation to feel like you can slow down and kind of talk through that and feel like you're being listened to is quite significant.
I do love too.
Yeah.
I saw that our audience also talked about the CMEs and that she'd be interested in that part as well. And that was Joan. And we have a lot of providers, right, Alyssa? Like we speak your language. We are comprehensive care. We are whole patient care. Been doing this for 15 years, and we have over 200 providers that provide this type of service, and we're always looking for them to get continued education. Many get it in this space, so for example, oncology massage, and they'll get it in their actual therapy space, but to have this as another option could be really valuable. So I will make sure I pass that along to our team that is charged with getting our providers all up to speed with our credentials and everything that we do to serve our Unite for Her community. So thank you, Joan, for posting that. And thank you, Alyssa, for thinking about that part of the community that really would like to learn more. I think that was the biggest gap, right? Is that the physicians and the medical teams are all about treating that cancer. And yet there's this whole nother part that Unite for Her found that space. And you have brought that space to life, and that together, this comprehensive care increases better outcomes all the way across the board, all the way across the board.
No, I really appreciate, your mission and also what people are saying in the chat. I think particularly to the timeline to treatment, and this is, again, if we're talking about the first part, which is that diagnosis, and what I hear often from especially younger breast cancer patients is that they now look back and feel like they were so rushed. It was just like this emergency, and they're like, looking back, was it really an emergency, or did I have another week to make a decision? But, having the wherewithal as a young woman to push back and say, this is great, but I need some more time. Like I need, I'm just not 100% there. But when you're scared, and the plan is in place, the plan is in place. And I think that if the messaging that you guys share with people is, peer to peer, that sometimes you have more time than you think, or, sometimes you don't, but really, I think that's a shared sentiment I definitely hear. There was also a question about how it could be applied in survivorship. I think as we got the leadership collaborative together, that's the natural place where some of these institutions took it. So they changed their survivorship to survivorship and wellness, or survivorship and well-being. They took the focus off of like, is this just about avoiding recurrence, or is this about actually what we would say recovery? Getting you back. People say, I want my life back. I want to get back to where I was. It's like, that's better than where I am now. Even if that wasn't at that time, you would have said you wanted to get to the next higher level. But people want to get their life back, and they want to recover. And, goals can be continually changed and reset higher and higher. But the rural population and where you're living, Katie, I hear you're saying, you're highly rural, and that is a very challenging place. And so what I tell people when they're in that kind of situation is we do have to lean into the virtual spaces. And I know that's not the same, but I refer people all the time to the Smith Center in Washington, D.C., because their programming is free to nearly free. It's basically free if you can't pay, and virtual, and some of that survivorship, but it's not physical care, so I hear what you're saying. Also, another center that was involved in the leadership collaborative is at Inova Shar Cancer Center in Northern Virginia, and all their virtual programming is open to anyone with a diagnosis of cancer who lives anywhere in this country, and I don't know, maybe outside the country, and that's also free through philanthropic funds. And so I do send my patients to that if they feel like they can't drive, or there's nothing nearby. In terms of, then you have exercise access at home and some of that expertise at home for nutrition and things like that.
I love that.
Sorry, I don't know if there's like a raise hand option, but can
I? Perfect, Katie. Perfect.
So cool. My question on survivorship is like, first, I love this whole health, whole human, because I didn't realize how much like your identity is going to be shook because your body is going to be altered, and then you get to the end of treatment and you think there's going to be a finish line. But I darkly call it like the gifts of cancer, like the ways that you're permanently altered, and you're going to realize this over the months and the years that come after treatment. So like you're never done. And so I mean, like for survivorship, like helping people navigate survivorship with like self-compassion and ways to nourish, because I feel like, at least in my experience, the care drops off. And there's not a public perception that you're going to be struggling. So really, I feel like it's isolating because you have to learn how to navigate a whole new body that's still having symptoms come up and is still like pretty deeply damaged.
Yeah, I think, you speak the truth, and you speak to the point that, it's like, just because the cancer is gone from my body doesn't mean that I'm now healed, right? And so healing, and somebody put, healing is not used in metastatic disease, or is it, are there different ways to approach this languaging around what is healing? What does it look like in survivorship? What does it look like in stage 4 or metastatic disease to be still actively healing? What would be healing to you? It's partly that starting to have those conversations, and how do you have those, and who do you have those with if that's not part of your cancer care world? That's not part of where you're. And I think there was a lot of people around that circle of team, and sometimes, we haven't been referred to all of them. Sometimes it's people in a spiritual capacity, like, that they're a spiritual counselor, or sometimes it's somebody who deals with the dysmorphia, like actually getting the mental in line with the physical, and that might be a mental health provider. Not that there's a disorder. It's just that I need somebody to listen to me to talk about this thing, and they need to have some sort of expertise in the medical part of it to some degree, And so I think this is partly, like you said, having self-compassion and all that. But when you can't, like, or something's wrong, it's like also being able to say, I know something's wrong, and I'm going to continue to advocate for myself, because I know to heal, I'm going to have to speak up to someone, and they might not be able to help me. Like it's like asking for help and knowing you may get either nothing or shut down, or you might have to go to the next person on the list, but that you're not going to give up. And that comes out of community. And for women, you could say sisterhood, but that comes out of being connected to people who say, okay, if the outcome is you didn't get anywhere with that inquiry, we're going to help you think of the next thing. And so some of that is really reconnecting to people who maybe are no longer with you during the journey because they fell off when you were busy with treatment and you haven't reconnected, because some of those people can really help us. I think the community aspect is important. It doesn't have to be people who also have a history of cancer to help us advocate for ourselves. It's the people who see who we can be and where we are right now.
Thank you.
Yeah, Katie, if I can
love
jump
that.
in too, I just you're bringing me back 20 years, and I remember this. I remember a young woman and just feeling like I rang this bell and I was supposed to be done, and I looked in the mirror and I was like, "Are you kidding me? I am so not done. I look like a 12-year-old boy. I have no breast. I didn't get reconstructed right away. Wanted to have more children. Had 3 little kids, and how am I going to get my life back?" And I hear you. I hear you, and that is something that Unite for Her offers with even tonight, like this community that is virtual, just like our Dr. McManamon was saying. Like sometimes we cannot get in person, but we create this space that understands where you're coming from and brings the top professionals to you. And then of course, like the different links that Jenny put in the chat that Dr. McManamon was talking about as well, and Unite for Her's library, like in the cooking webinars that Erin does. The lens of navigation or nurse navigation has to open up more, because it's not just nurse navigation. It could be nutrition navigation. It could be financial navigation. It can be, movement navigation, but all of that helps you emotionally and physically. You have to find that place that gives you that feeling of being seen and heard. And I just love what you said, Alyssa, and Katie. Thank you for bringing it up, because I know that feeling, and Unite for Her works for that, like for you to be with us for always, right? Like we are here 3 times a month and virtually, or movement on Mondays, and you can do that live, and then bringing resources like tonight and this book where you get other resources to find your people, right? Find what works for you.
And if I could, I don't want to pile on a list of things to do, but I would say that sometimes when we're so alone, like you were talking about the self-compassion part, it just makes me think of like leaning into being my own best friend. There's something called Morning Pages. If you've never read about that, it's Julia Cameron's book. Yeah, she's amazing. But Julia Cameron writes about how to do morning pages and finding your inner resources, like your inner guide, kind of your inner wisdom, so to speak, by writing. There's some data behind what they call therapeutic writing or journaling, and that's well described. The guy who's done that work is Penny Bacher, and he's done it with people who have healed, after treatment for breast cancer and whatnot, just showing that anxiety, depression, some of the other things that come after a diagnosis are markedly decreased just with therapeutic writing, in which case it's journaling. So we have some pocket guides about that can give you some of the data if you're a data person, but that's a free thing that just becomes a habit. And it might not be for you, but I just share that because there's power in really leaning into your own power. Once you've gone through something and you're like, you still have the inner resources. It's just they haven't been tapped in that other way.
And I will say, the integrative services that you cover in part 3, the expansiveness at which you call out, I think is a good reminder for all of us that there are these different avenues for people to explore. Certainly it includes all of what we do at Unite for Her, but you're also talking about aromatherapy, music therapy, all of the mind body psychosocial oncology, so energy, mindfulness, so Tai Chi. So it really, I think, is just sort of a call out that there are all of these other avenues of integrative support at no matter at what point a patient taps into them, but they can really be an eye opener. It can open to a supportive community. It can lend itself, just like journaling can, to be really helpful and really healing. And I think the book did that really well, and just sort of covering everything, and perhaps thinking like, I didn't think about art therapy. I love art. I love that creative outlet, or music therapy. So I think that was really nice just to see, there's all this out there that could be available to someone.
Yeah, you talk to art and music therapists, they're like, of course there are whole people. Like, they're like, this is our language, so seek them out if you can get it paid by insurance on top. Yes, because they are like, we are your people. Social workers are like, we are your people. Like, where has this been? We already know this, so we're just like, in those cases, we're speaking to the choir, but those are the parts of the team that maybe weren't available to you or tapped into, and they're still there. They're still out there somewhere. So that's a great point. I think also to your point, like, and I give a lot of credit to Wayne for educating me. Yoga's not for everybody, right? Like, I love it, but it doesn't mean it's going to work for everybody. And so having all the modalities as, evidence-based as possible, and making that information available so people who gravitate to different sort of things can get to the right thing for them that is healing. And we have Jenny, I don't know, there's a mind-body therapy sort of, it's like a guide to help you pick what works for you. If your personality is like this or you like this, then go down this road. And that's on our website too. And I find that to be a really great sort of way to guide yourself when you're like, I need to do something to help my stress or whatever, but I don't know what I really want to do, or I really don't want to meditate. What else can I do? And so that's a resource we have.
I love that. Wonderful. And one other resource I'll call out, and I'm curious if anyone found this helpful or if there was anything else that really spoke out to any of our readers tonight, was your Hope Note questions. I think just sort of in helping someone sort of organize their thoughts and get them even put down on paper about like what's important to them, what activities are meaningful, all of this stuff that a person wants to be able to share with their social worker, their oncology team, but specifically like at a time when it feels chaotic. I feel like this was a really great grounding exercise that someone could just read through and think about as they're communicating with their team. So I found that I really loved to see that, because I thought, oh, this is a great way to help someone sort of organize their thoughts so that they feel like they are participating in their whole body care.
That's a really beautiful, that's like, I never would have thought, oh, the person would read the book and then think, I'm going to answer these questions and take it to my doctor, even if they don't ask me. Like, that is next level, right? That's like, you're going to already just do the work for them, and they don't even have to be thinking about whole person care. They don't even have to know what the words are, whole person cancer care. I think that's great. An even simpler one would be, one of the foundational questions that we did not make up is the patient dignity question, and that's available online. Maybe it was, more in the realm of palliative care, but we pulled that question and put it on the personal health inventory because it's such an amazing question. What do I need to know about you as a person to give you the best care possible? I honestly feel like if I just was given that by every patient who felt they could answer that question up front for that day, that I can provide them much better service that day. It could be different tomorrow, but if you can tell me that today, I'm listening. At least if you're listening, that is helpful information. And so even if you don't do all the hope questions, I think the patient dignity question is just amazing. Thank you for that idea, though. Great.
Yeah, agreed. So I know we have a few minutes left, and if anyone has any particular questions for Dr. McManamon, any parts of the book, or wants to share your thoughts as you moved through the chapters or anything that resonated with you, I certainly want to give our audience time to come off of mute, share your thoughts, questions, opinions, while we have her here. So please feel free to do that.
Yeah, and while you're thinking about it, I can't thank you enough for sharing that it is not one size fits all. It is not, one magic therapy that's going to do it for you. You got to find what resonates with you, and having these options and taking that quiz or asking these powerful questions on what could I do to relieve my stress? I'm not quite sure. And then leaning into some of these different things and trying them can be really powerful, because everybody might get to that outcome differently. And that's okay, because then you're going to live it for your lifestyle, right? You're not going to, it's an action wellness. Like, it is an action. It takes a lot of work. It just doesn't come easy. And when you wrap your head around the fact that you have to find what works for you as an individual, then all of a sudden you gain momentum and it becomes contagious and you feel better. And then you want to do that more and more. Just like you talked about yoga, right? And meditation. It might not be for everybody, but boy, taking a walk or some art therapy, that might strike a chord with you. And that's what this book ends up really allowing you to ask the right questions so that it's personalized for you. So thank you for that.
Yeah, no, that's great. What you just said made me think. One time I had a conversation with Wayne where he said healing is hard. And I was like, I didn't like that. I was like, what? I don't know if I like that, but it's like true, but it's like, so when I was saying before, it might be simple, but not easy. It's kind of like with healing, same thing. If you've ever seen that trajectory, there's a picture of a line. It's like going up from the left corner to the right corner, and then it goes crazy squiggles, and then it goes back to a line. And so this whole part in the middle is kind of that healing, right, before we get to the next level. And so he's right, you're right. I think we have to try all things that.
And sometimes it's not easy, and it does feel a little chaotic, and there's some finding out that you have to do. And but that's all normal. I remember the best thing that my acupuncturist said to me when I was going through my treatment is that, Susan, you have every right to feel anxiety and depression, and that is a normal feeling, because if you weren't feeling that, you just got diagnosed with cancer. That's traumatic. Now let's meet you where you are. And right now you're giving them a tool to meet them where they are. For her gives them a tool to meet them where they are. And that, when you hear it from multiple different resources and such trusted resources, like yourself, it just adds credibility to what they can do next to have that survivorship program.
Yeah. I think, the book can't be all things to all people. I mean, we really wanted to, we thought about this hard in terms of, you all are beautiful to read or be interested in the book. And yet the core audience is people who aren't hopefully exhausted by their cancer diagnosis, so the people who can help support the people who are exhausted and on treatment. And so if that looks like a caregiver, or if that looks like somebody on a care team that you think is open to the messaging, who's trying to do something but doesn't have community and just needs to hear that other places are doing this, I think that's really where we are with the book, in trying to get it to people who are, able to hear the message and then be bolstered by it, But I think about patients who've been diagnosed, and I think you don't need one more thing to do. Like, you don't need to read this book, but you can read this book, but you don't have to read this book. And so it's not a have to, but it is there, like you said, to help people feel more empowered. And that's exactly right.
And I do have a question for you, Dr. McManamon, that because you bring up a good point. I had one of our members that had emailed and is working through the book and reading, and it felt a little overwhelming to her, sort of kind of thinking that she may have to tackle all of these things. So, any suggestions for how a person can start or where to start? So perhaps they feel motivated and they feel productive, but it's not overwhelming.
Mm-hmm. Yeah. Usually first it's about what are you going to stop doing? So if you're going to think about adding something that you're not doing, is there something that you're going to stop doing? So and same thing for care teams. What are you going to stop doing that is not value add? It's not serving you now. It doesn't speak to this, what matters to you now. So start there, because I can imagine it's overwhelming to add on top of what everybody's already doing. After that, I think the next thing I'm starting to move more toward what feels good, like really checking in, and that might look like journaling, or that might just look like, well, what does it feel like when I think about this versus that? What does it feel like in my body? And we're very disembodied. I mean, I feel like medical people, I'm just going to speak for myself, we're very disembodied. I could go hours without peeing, right? That's disembodiment. That's my training. People who've been through a cancer diagnosis, who've had things done to their body, that's a potentially disembodying experience. I'm not saying that's true for everybody, okay? That's the language of trauma and recovery and all of this, and healing is part of all of that. What I would say is that, checking in though with my physical responses to, does this particular thing sound interesting to me? Acupuncture? Or does this Tai Chi sound interesting? Okay, neither, and just make that up, right? So I think the check-in part of really consulting yourself and believing that the expert on the patient is the patient, and therefore that's you, and what maybe intuitively is sounding like of interest or feeling good. You also know what your finances are going to cover and what's not. And you don't need to spend time, looking at things that you're like, my insurance is like the lowest insurance. It doesn't cover any of this. And unless I can find Unite for Her to help cover some of this, I'm going to look to a different thing, on this menu. So the book, it's been mentioned to me that the book can be read in bits and pieces. It doesn't have to be read straight through. It doesn't all have to be read. You could just read the part that's inspiring to you and leave it at that. And there's no points lost in the brownie point world for not reading the whole book or doing all the things.
I love that. I think that's a good reminder for all of us that, that self check-in, and just sort of identifying what feels good to us, what feels, good in our body is I think a good tip for all of us to be reminded of. And Julie made a really great comment in the chat that she's told part of her healing is grieving her pre-cancer life.
No, it was very powerful, Julie. I agree with that. We all know before cancer, I think I look at my life before cancer and after cancer. I look at my life 39 and under, 39 and older. And I don't mean to. It's just how my life has divided. But I also saw this place where it became a really good teacher for me. It took years, and it's not easy, but it became a very good teacher because I learned my body. I learned how I was, my hot buttons, and what I had to watch out for if I'm exhausted or if I did not sleep, like what my non-negotiables are. We saw in your grid, sleep is one of them, right? If we can only have a prescription for sleep. So I just thought that was really powerful to bring up, because that is very truthful. It's very truthful.
Mm-hmm. Sorry, somebody just asked for
It's a man author.
Yeah. I think it's Penny Bacher. Sorry, I'm just the person. Penny, he's a PhD, and I think he's based out of Texas. And so if you look up therapeutic writing and that name, you'll probably find things. Or if you look at our therapeutic writing or journaling pocket guide, I think it might be mentioned in that as well. If that's helpful, that was to Joan. Or sorry, I'm getting behind on the chat. That was to somebody.
Yeah,
Kelly. Thank you, Kelly, for the question.
Yeah.
Wonderful.
Yeah, you guys have much more wisdom than I do, and I just really thank you for letting me learn from you today, because there's things I'm going to keep thinking about having been here today, and I just hope you know that, because that's the truth. And I really just want to leave with that from my side, that this is always learning, and today I certainly learned. So thank you.
No, us too. So good. Always learning.
Wonderful. Any final questions for Dr. McManamon as we wrap up this evening?
I was just looking at Joan's, comment and just feeling like she had to be strong, and you try, and me too, Joan, I tried and it didn't quite work and I tried something else and it's okay. Remember that is normal. And that is where you are today. It's not going to be where you are 3 months from now. And you don't need to be you don't have to be anything. There's no right way to deal with a cancer diagnosis. Everybody does it a little differently. And however you present yourself that day is where you need to be. And then you utilize your resources. So don't feel like you have to try and be anything.
Yeah.
Yeah.
Wonderful. All right. Dr. McManamon, thank you so much. And Jenny, thank you for all of your support with being here. This was a fantastic summer book series. It was a great way to wrap up. And hopefully, if you haven't had a chance to read it, or if you feel like if you're a caregiver and this may be helpful for someone in your life, you can have it available. There's lots of great information in here and tools. So definitely recommend keeping this nearby. So thank you for spending your time with us this evening. We appreciate you.
Yeah, very much so. And I love that you gave us the grace to say, hey, you're not going to get tested on this book. It's not a summer reading. Nobody's going to test you when you get back to school. Just do 1 chapter or 2 or 3. No, it's okay. It's okay.
This time of year stresses all of us out with grades and testing on summer book reading. So we've all passed. We all got an A+.
We've all passed. That's right. We've all passed. Oh, thank you so
Wonderful.
much. And we look forward to connecting with you both again. Really appreciate you being here. So good, Erin. We had a great summer book series. All with
This
such
was wonderful.
alignment, right? Such alignment on what Unite for Her stands for and just the credibility that they bring to the table as well. And I love that Dr. McManamon was also saying that we're always learning, because we say that all the time. Erin, myself, our team, always learning from those around us. So another great session. Thank you, Erin.
Yeah, absolutely. And we're so grateful to our guests. And it's so wonderful to have physicians in the oncology space speaking that integrative language and really moving the needle forward. So we've got great tools, and come back and re-listen. You can rewatch the slides in the recording to see a little bit more of what Dr. McManamon was touching on, but we've got lots of links as well. Healing Works Foundation is filled with information, as well as uniteforher.org. So be sure to tap into those resources to find what will support you. So with that, I want to give one final thanks to our sponsors for being the support for us as we continue to bring our digital education series to our community. So tonight, we are supported by West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, now part of AbbVie. And please be on the lookout in September as we move forward with our dietitian team for our virtual hangout on the 11th, as well as our speaker series on September 12th about fostering calm and resilience, that topic of stress and its relationship with cancer, plus so much more for Ovarian Cancer Awareness Month and even more for Breast Cancer Awareness Month. But I'm not getting ahead of myself. We've got so much more to cover first. So thank you so much, everyone, for being here.